Good morning, everyone. Today, I'm going to be going over bones of the face and skull. So we have gone over the axial skeleton and the appendicular skeleton. And today I just wanted to do a more concentrated lesson. So just going back to review the axial skeleton. Is the bones that revolve around the vertical axis of the skeleton. So we're talking the bones of the head, the neck, the ribs, and the spine. The appendicular skeleton are the appendages that connect to the axis of the body. So your pelvic and your shoulder girdles and your appendages, your upper and lower extremities. So the skull provides attachment sites for muscles and membranes, and it protects and supports the brain and sense organs. These bones provide attachment for muscles that control the head and control facial expressions, and muscles of mastication, which is chewing. So there's a few features of the skull that I'd like to highlight. Sutures are immovable interlocking joints that join the skull bones together. In restorative art, you learn about the different sutures like the lambdoidal suture. Fontanelles are spaces between cranial bones that are filled with fibrous membranes that allow pliability for the skull as it passes through the birth canal. Sorry, my cat's nudging my computer if you see it moving. So fontanelles, when a baby is born, it's mostly cartilage, and we continue to form into bones as we grow older. Little buttercup. Sutural bones are tiny bones that develop within sutures. The cranial vault is the top, sides, and front and back of the cranium, and the cranial floor is the bottom of the cranium. So this is a picture of the cranial vault right here. And if you'll remember in class, I took the top of the skull off and showed you that. I wish I had it with me at home. It'd be easier to show this. So let's get started with bones of the skull. So the skull contains 22 bones and rests on the superior end of the vertebral column. The bones of the skull are grouped into two categories: cranial bones and facial bones. The cranial bones or the cranium form the cranial cavity, which encloses and protects the brain. There's 8 cranial bones, and that's the frontal bone, 2 parietal bones, 2 temporal bones, the occipital bone, the sphenoid bone, and the ethmoid bone. There are 14 facial bones that form the face, 2 nasal bones, 2 maxillae or maxillas. The singular for this is the maxilla. 2 zygomatic bones, the mandible, 2 lacrimal bones, 2 palatine bones, 2 inferior nasal conchae, and the vomer bone. So besides forming the large cranial cavity, the skull also forms several smaller cavities, including the nasal cavity and the orbits, which are the eye sockets. And all of these open to the exterior. Certain skull bones also contain cavities called paranasal sinuses that are lined with mucous membranes and open into the nasal cavity. And then also within the skull are the small, middle, and inner ear cavities that house the structures involved in hearing and equilibrium, which is our balance. So let's start with the frontal bone. The frontal bone forms the forehead. So the anterior part of the cranium, remember anterior means towards the front, and we're talking about anatomical position. It forms the roof of the orbits or the eye sockets and most of the anterior or front part of the cranial floor. There are two parietal bones, and you'll see these highlighted in green. They form the greater portion of the sides and roof of the cranial cavity. So I think in restorative art, we talk about like a king's crown or a queen's crown, and how if it were to rest on the head, it would rest on the parietal bones. The paired temporal bones form the lower sides of the cranium and surround the ears. So it forms the inferior or lower lateral to the side of the cranium and part of the cranial floor. And projecting from the inferior portion or the lower portion of the temporal bone is the zygomatic process, which forms a joint with the temporal process of the zygomatic bone or the cheekbone. So together, the zygomatic process of the temporal bone and the temporal process of the zygomatic bone form a zygomatic arch. So remember, when we talk about zygomatic, that's going to go to the facial bones, but the temporal bones, you can see where it articulates with this. Inferior or lower than the zygomatic process is an external opening in the temporal bone. And this is the external auditory meatus. So this is a passageway. It's the ear canal, and it directs sound waves into the ear. Let's go to the occipital bone, which makes up the lower back of the cranium. The occipital bone forms the posterior part and most of the base of the skull. And within the occipital bone is the foramen magnum, which is the inferior part of this bone. So this is within this foramen or opening, the medulla oblongata connects with the spinal cord. So this is a passageway for the spinal cord to go from the brain and then inferiorly. The sphenoid bone lies at the middle of the base of the skull. This bone is the keystone of the cranial floor because it articulates with all the other cranial bones and it holds them all together. The trivia question that you'll get from this is the shape of it. And there's two different ways you could say this. You could say it's bat wing shaped, or it resembles a butterfly with outstretched wings. The ethmoid bone is a sponge-like, it's sponge-like in appearance, and it's located in the anterior part of the cranial floor, medial to the orbits. The ethmoid bone forms the part of the anterior cranial floor, so front cranial floor. It forms the medial wall of the orbits or eye sockets, the superior portion of the nasal septum that divides the nasal cavity into right and left sides, and most of the superior walls of the nasal cavity, side walls. Within this, we have the cribriform plate of the ethmoid bone, and it lies in the anterior cranial floor and forms the roof of the nasal cavity. And this is this contains the olfactory, so olfactory means sense of smell, foramina. And so this is an opening through which smell sensations are transmitted to the brain. This is through the cribriform plate of the ethmoid bone. So those are your 8 cranial bones. And then we have 14 facial bones. Most of them are in pairs. Facial bones include the nasal bones, the maxillae, the zygomatic bones, lacrimal bones, palatine bones, inferior nasal conchae, the vomer, and the mandible. Whoops. So let's start with the nasal bones. This is what we think of as the bridge of the nose. If you wear glasses, this is where the glasses will rest, at the top of the bridge of the nose. The paired nasal bones are small, flattened, rectangular shaped bones that form the bridge of the nose. And these small bones protect the upper entry to the nasal cavity and provide attachment for a couple of thin muscles of facial expression. The lacrimal bones, these are a pair. These are the smallest bones of the face, and they are posterior and lateral, so towards the back and sides to the nasal bones, and they form part of the medial wall of each orbit. Each of these lacrimal bones contains a lacrimal fossa, which is a vertical tunnel formed with the maxilla, and this is where tears pass into the nasal cavity. And lacrimal is derived from the Latin word for tears. The vomer bone is a kind of triangular shaped bone on the floor of the nasal cavity, and it articulates superiorly or towards the top with the perpendicular plate of the ethmoid bone and sphenoid bone, and inferiorly or lower with both the maxillae and the palatine bones. So the vomer bone forms the inferior portion of the bony nasal septum. The two zygomatic bones, these are what we call cheekbones, form the prominences of the cheeks and part of the lateral wall and floor of each orbit or eye socket. We have two L-shaped palatine bones, and these form the posterior portion of the hard palate, part of the floor and the lateral wall of the nasal cavity. The maxillae, or the upper jaw bones, articulate with every bone of the face except for the mandible or the lower jawbone. The maxillae form part of the floors of the orbits, part of the lateral walls and floor of the nasal cavity, and most of the hard palate of the mouth. And the hard palate is the bony roof of the mouth, and it's formed by the palatine processes of the maxillae and horizontal plates of the palatine bones. The hard palate is what separates the nasal cavity from the oral cavity. The mandible is the lower jaw bone. It's the largest, strongest facial bone, and it's the only freely movable skull bone other than the auditory ossicles, which are the small bones of the ear, which have to vibrate. The inferior nasal conchae, remember, let me go back. Remember the mandible is horseshoe-shaped jawbone. It's the largest and strongest. The inferior nasal conchae are inferior to the middle nasal conchae of the ethmoid bone and are separate bones that are not part of the ethmoid. These are scroll-like bones that form part of the inferior lateral wall of the nasal cavity, and they project into the nasal cavity. There's three pairs of these, superior, middle, and inferior, and they increase the surface area of the nasal cavity and help swirl and filter air before it passes into the lungs. The auditory ossicles are the bones of the ear, and they're named based on their shape. So we have the malleus, which is the hammer, the incus, which is shaped like an anvil, and the stapes, which is shaped like a stirrup. Moving to the neck region, the hyoid bone is a free-floating bone of the neck. It's isolated from all other bones and connected by ligaments to the styloid processes of the temporal bones. Muscles from the tongue, neck, pharynx, and larynx attach to the hyoid bone and contribute to movements involving swallowing and speech. And that's where I'm going to end this, where we just focused on bones of the head and I went a little into the neck. So 8 cranial bones, 14 facial bones. I hope this helps, and reach out to me if you have any questions or concerns. Thanks for tuning in today.